Peace be to you all. Assalamu alaikum. This is Omar Abdul Malik, physician assistant and health educator. I should say physician assistant / associate. Today is September 7th, 2021. It's my birthday. I just turned 53. I mention that only because I just found out that two relatively well-known black men in my age group just died from drug overdoses. Fuquan Johnson, who was a comedian, and Michael Williams, who was a very relatively well-known actor. And I think he was 54, and Fuquan Johnson was in his 40s. They didn't die together. They were with different groups of people in different areas. So I think Fuquan Johnson, it was fentanyl overdose, and Michael Williams, it was heroin, if I'm not mistaken. But just based on my experience, drug use and certainly drug overdose, it's people who are trying to self-medicate their mental health issues, and a lot of those issues have come from unaddressed trauma, things that were done to them during their childhood and formative years, whether it was abandonment or horrible abuse, molestation in some cases. We especially in the black urban community, if you're a man, to cry or to talk about your problems or show signs of being adversely affected by these things, it's often seen as a sign of weakness. You're called a punk. You're called soft. It's I think it's one of the more toxic elements in our community. I've done what I can do about it. I've helped provide mental health services, especially when I worked in outpatient clinics for several years. I worked with substance abuse advisors. There's a drug called, a substance called Suboxone that helps people get off opioids. So, but we're going to see a lot more instances like this. It was DMX, who was a rapper, several weeks ago, and another brother died in the similar situations a few weeks after that. And then just dying from preventable diseases, not just drug overdoses, but things like heart attacks and strokes and different types of respiratory failure from COPD. I've talked about this before, how black men have got a markedly lower life expectancy compared to other groups. And a lot of these things are due to unaddressed issues in our community. Certainly mental health issues, and those that are self-medicated with illicit drugs is one of the big issues. I don't know what to do about it other than what I've been doing for the past several years. I've been in the healthcare field for more than 30 years, 20 of which has been as a PA and health educator. There's not, I don't know how much of an impact I've made. I've tried to help younger groups. I'm leaving work now, but I work in Anacostia, DC, which is probably one of the most violent areas of DC. It's a very high homicide rate here, very, very high drug use rate. I mean, I see folks laying in the street in the summer. But we can only do as much as we can do. DSM-5, for those of you guys who have been who've studied medicine, you got to take your psychiatry and your mental health rotations in your studying the DSM-5. It's the mental health manual. It lists things like substance abuse and depression, obviously, and PTSD as medical disorders. So we can only do but so much, and clearly money isn't always the panacea that we're looking for. A lot of us talk about, especially in my community, in the Black urban community, we talk about, yeah, we need more money. Well, these were guys that were doing okay. I mean, they weren't super rich, but they were doing all right relative to a lot of other people in terms of finances. So it's not always money. Money can't cure everything, but it's there's a spiritual and mental awareness and healing that needs to take place. There's different modalities for that. I found it through my religion, Islam. Other people found it through the church or their temples or through physical activity. But it's a very tragic loss because both of these were relatively young black men who were, by all accounts, talented and had bright futures for them. But that's it for now. I'm hoping, God willing, inshallah, to live at least another 20 years. I want to help my wife finish raising our children, and there's some things that I'd like to accomplish before I kick the proverbial bucket. But mental health and things like that are a big issue in the black community. I don't know what can be done about it, if anything, to completely stop it. But I'd like to know what your thoughts are. And I understand that other communities, other ethnicities, other races, even though I believe that there's only one race, which is the human race, but since we're broken up in these racial groups, I understand that other groups have got their own issues, but I am a black man. I'm raising black young men. I've got a black dad, so that's what my focus is on, at least for now. What are your thoughts about this? What can be done, if anything, to help black men kind of navigate this system, such that we won't see these black men dying from preventable causes at relatively young ages? That's it for now. You can do quite a bit as a PA. If you're interested in that, you can contact me. Be happy to help you however I can. I wish you all the best of success in your positive endeavors. Take care. Peace.